Well, there are obviously a range of psychosocial treatment interventions that have been shown to be helpful for pathological gambling. Motivational interviewing, cognitive behavioral techniques, as well as a technique called imaginal desensitization. What we've done in a recent program that we've put together is really combining the best of all of these worlds in a 6 to 7 session cognitive behavioral program. We use motivational interviewing techniques. We use cognitive aspects to work on gambling distortions, learning new behaviors. But the unique element is that we use cue exposures, largely borrowed from the world of obsessive compulsive disorder. And what we try to do is we have the gambler create scripts for themselves, very uniquely individualized treatment scripts, whereby they will report what their triggers are. Is it, for example, that when they're driving home, they see a billboard and then they get a craving and a desire to gamble and off they go? Is it on a Friday night when they're feeling lonely and depressed? And we have each gambler create 2 or 3 of these scripts. They then actually dictate the scripts into a tape recorder, and they will listen to the tapes over and over again. And the goal there is that they learn from the cognitive skills how to deal with their cravings, but we want the cravings to be elicited. We want them to learn how to deal with them so they don't take them by surprise on a Friday night when they suddenly want to go and then impulsively off they go to the casino. So by doing this, they actually become desensitized to the triggers for their own gambling behavior. We've actually found this helpful. We did a large study looking at people who used this, and people, one, really enjoyed doing the scripts and listening to them. And over a period of 6 months, people were generally very well off and had reduced their gambling to the point that I think almost about 70% of the people in the study actually had stopped gambling and then continued to use these tapes. This is a procedure that's been done. The taping is a little bit different, but the cue exposures have been used in the field of anxiety and OCD for many years, and we tried to import that into gambling because it does have a kind of a compulsive nature to it in addition to its addictive quality.